Good evening, everyone, and welcome to this wonderful session. I hope all your preparation for the NEET PG with only 200 MCQs. Wow, what a bliss. Once upon a time, we used to be monopoly in the world of coaching for the Andhra Pradesh State PG entrance. That those days used to be a combined AP. Almost all 4,000, 5,000 students used to attend the mock test. Dr. Murali Bharadwaz means APPG in those days. But that used to be a 200 multiple choice question test. And I'm really glad to know that even NEET PG now became 200 questions. So every day we have 100 MCQs. It has been created as a mock test on the Incus. You can nicely download and enjoy the test. And every day evening 6 o'clock there is a discussion. And these 100 questions in the test are most expected questions, basically. So that is the reason whenever you do these questions wrong, make sure that those topics you nail them down. Now I'm going to show you how to see on the Incus learning app, where are these tests located. First, you need to download the Incus learning app. So if you download that, where do you see them? Where do you see them? So, yeah. Yeah, you see them here. Let me take it to full screen. Yes. So once you come to the Incus app, you have this area which is courses. These are videos. And this is you also can record a 3-minute learning video and can be able to upload. So like that, just like TikTok, if everyone happens to upload a 3-minute learning video while they are studying, so much of the content become ready, right? So once you come to this area, which is called courses. In the courses, you have NEET PG. In that you have one quiz type, other is called video courses. In the quiz courses, you have this 40 NEET PG grant tests, 100 MCQ tests and discussion. So once you click on this, you have the 42 quiz tournaments. I mean the 40 quiz tournaments. 10th April, 11th April, 12th April, 13th April, and so on. So once you go to the quiz, for example, today is 5th March quiz. So once you say play, then the questions will load and you can start playing the questions. So once you finish the questions, in the same area you have the history. You have the history here. In the tournaments, you have the history here. So here the test that you have played will come. So once you go to the review of that particular test, then you can be able to see all the questions, etc., etc. So that is how this daily full-scale grant test is made available. So you should remember, you need to download the Incus quiz app, go to the courses. There 40 NEET PG grant tests, 100 MCQ tests and discussions. This is the place. So every day, that particular day's quiz is being loaded. So just you need to go to the quiz and start playing the quiz. So that's what you need to do, right? So with that preamble, let me come back and take up the today's test discussion. So Barry is asking, you will come online to discuss this 100, sir? Very much, doctor. So every day the idea is you take the test on the Incus app and I come to discuss the test. That is the plan. Okay. So all the 40 days, 40 into 100 most expected questions you take daily as a test on the Incus app, and there will be 40 live discussions every day evening. So that is the plan. So let's make the great beginning, doctor. That's the reason I always advise you, take the test before the discussion, right? Now, vaccine flexibility with a stereotype verbal behavioral signs and negative symptoms. Where do you see, doc? Good to see almost 13 online students every day evening 6 o'clock. One full-scale grand test discussion will be there for the next 40 days, 40 grand tests. Catatonic schizophrenia. Keep punching your answers also. Seasonal affective disorder. Typically, those who live closer to the equator, they have a greater exposure to sun. Those who are away towards the polar areas, they are more liable to develop the seasonal affective disorder, is what you need to remember. It's more common in the women than in the case of the men, and it will improve by altering the light exposure therapy, is what you need to remember. So these are all antipsychotics, except the venlafaxine. These are all antipsychotics. So what is venlafaxine? It is an antidepressant. So citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, sertraline, they're all what? SSRIs. SNRIs, duloxetine, venlafaxine, minalcipram, they're all SNRIs. Then serotonin receptor antagonists are mirtazapine, trazodone, bupropion, niacin. Then MAO inhibitors are phenylizine, salicylin, moclobamide, etc., etc. And tricyclic antidepressants are amitriptyline, clomipramine, imipramine, amoxicillin, desipramine, nortriptyline, etc., etc. So what is the drug of choice for the adult attention deficit hyperactivity disorder? It is the methylphenidate is one of the favorite questions of the examiner. So if you have done this question wrong, what you should do? These are all most expected questions in the NEET PG 2021. From the most expected high yield topics. So you have to be very sure. If you have done this question wrong, immediately you need to go back to the video library, which is there on the Incus learning app, and try to do the revision, right, of that topic. Delirium is because of the deficiency of acetylcholine. So any medication that blocks delirium, like atropine, lead to delirium. How do you remember? Atropine is anticholinergic. So that is the reason those who take atropine will go into delirium. Gamma rays. Gamma rays do not have a mass. They do not have any charge. They're intranuclear is what you need to remember. And they won't be deflected by any electric or magnetic field. So what is the SI unit of absorbed dose of radiation? Gray is what you need to remember. So if you look at one of the favorite questions of the examiner, the different units of radiation, doctor. Absorbed dose, it is the energy per unit mass. Gray is the unit. Equivalent dose, it is the absorbed dose into radiation weighting factor. Sievert. Effective dose, it is a sum of the equivalent dose to all the organs and tissues exposed. Sievert. Then that's how the different units of radiation. What is the maximum permissible dose of radiation during pregnancy? 0.5 rem. On chest X-ray, if you see an air bronchogram. So what does it mean? It means there is an area of consolidation which is there within the parenchyma of the lung. So it means to say it is intrapulmonary. So this is how you can see there is you are able to see the entire bronchial tree, right, doctor? So if there is any, if this opacification is because of a lesion in the parenchyma, absolutely right. Very good, Barry Allen. Keep punching your answers. That means to say that if you are able to see this air bronchogram as what you can see here, it is an indicator of consolidation. So once more, this is an example of air bronchogram. Now, just collapse ho gaya to, lung collapse. How does it basically appear? Displacement of the fissure, crowding of the vessels, and loss of the aeration. So that is what typically happens. So here you are able to see all the bronchovascular markings, but here you are unable to see. So how do you know whether it is because of the collapse of the lung or is it because of the pneumothorax? If there is a pneumothorax, then that lead to mediastinal shift is what you need to remember to the opposite side. Whereas the collapse of the lung will pull to ipsilateral side. That's a fundamental difference. Now, what is the maximum tissue reaction with suture material? Plain catgut is responsible. Plain catgut or chromic catgut often cause inflammatory tissue reaction. Whereas the non-absorbable sutures, they are encapsulated by a rim of connective tissue. And which has the highest malignant potential out of all this? It is the speckled leukoplakia. Speckled leukoplakia, which has the highest amount of malignant potential. So erythroplakia, speckled leukoplakia, and chronic hyperplastic candidiasis, they're all considered to be the high-risk lesions which can undergo malignant transformation. Whereas syphilitic glossitis are those who have iron deficiency due to Patterson-Kelly syndrome, siderophrenic dysphagia, oral submucous fibrosis, very common in the people who chew the pan regularly, medium risk lesions. Frey's syndrome, when the auriculotemporal nerve is abnormally innervating, where the person every time he eats, he gets sweat over the skin overlying the parotid. So we use the antiperspirants and tympanic neurectomy and botulinum toxin local injections. So these are the things that we use in the management of the Frey's syndrome. Now, burns wounds. Staphylococcus is the organism that colonizes the burns wounds. Now, whenever there is any fire, September 11 attack, fire, what lead to metabolic poisoning? It is the carbon monoxide which is responsible, because carbon monoxide has almost 240 times affinity to bind with the hemoglobin rather than oxygen. So that makes the hemoglobin ineffective as an oxygen carrier, is what you need to remember. Hippocratic feces, where do you see? Whenever there is any peritonitis, a pinched expression with sunken eyes, hollow cheeks and temples and relaxed lips in the person who is dying out of exhausting illness. Thyroiditis can be caused by the filaria. What are all the nerves that get injured whenever the submandibular salivary gland surgery is carried out? It is the hypoglossal, facial and lingual. Any of them can get affected. Similarly, anterofacial being facial artery and the mandibular branch of the marginal mandibular branch of the facial. Facial nerve gives 5 branches in the face. It's called pes anserinus, temporal, mandibular, buccal, zygomatic and cervical. So the marginal mandibular branch of the facial nerve also is in a close relation with the submandibular gland, is what you need to remember. Carcinoma breast classification, which is based on the size, pathological grade, width of the clear surgical margins. What is that called? Van Nuys prognostic index. So you have 1, 2, 3, the Van Nuys prognostic index. That's what you need to remember. In the breast carcinoma surgery, how much is the clear margin of the excision which is advocated? It is at least 1 centimeter is what you need to remember. Autosomal dominant breast carcinoma. It has BRCA1 and BRCA2. Limb reduction surgery of the lymphedema. What are all the various things? Charles operation, Homans. They are the ones. Homans, Charles, Lange operation. And cyst trunk, not only thyroglossal cyst, even cyst trunk is associated with the lymphedema. You know, cyst trunk's procedure in thyroglossal fistula, all of you know that. It is also associated with the limb reduction surgery of the lymphedema. Acute pancreatitis may. What are the complications? It leads to hypocalcemia, not hyper. It can lead to hyperglycemia, hypertriglyceridemia, or Kushner's retinopathy of acute pancreatitis, you should not forget. Basically, in acute pancreatitis, the calcium gets sequestered within the pancreatic area and that leads to hypocalcemia. So what is Kushner's retinopathy of pancreatitis? There is a sudden severe loss of the vision in a patient who has acute pancreatitis. And when you look at the fundus, this kind of cotton wool spots, these are the characteristic features of acute pancreatitis is what I want to underscore to all of you. And why do you get these cotton wool spots in Kushner's retinopathy? Posterior retinal artery undergoes occlusion with a lot of granulocytes. Wilms tumor typically presents with abdominal mass is what you need to remember. Very good. Barry Allen, excellent proactive participation. That is what is required, doctor. All these live classes are meant to bring out the best out of you guys. Where is the winner? Winner is within yourself, doctor. So Barry Allen, I want you to become proactive, pick up the Incus learning app, and whenever you get time, take a paper ke upar, you write a little notes and then shoot. I am Barry Allen for Incus app. I'm going to do a quick revision of acute pancreatitis. 1, 2, 3, 4, 5, 6 points and upload the video. I want thousands of students every day upload one or two videos of the cases that they see in the hospital, etc. So Incus learning app is basically created mainly for all of you to become a community, interact, upload videos, become fans, followers, etc., etc. So, Miss Rashid, you can't download the app. I mean, it's. Do you have an iOS phone? iOS version we are coming up shortly, but you can download it on the Google Play Store, doctor. No worries on that. Yeah. Now, did you try on Google Play Store, Miss Rashid? Can you please punch? In Google Play Store, it is very much available. And every day you take the test on the Incus app, daily test on the Incus app. There is a package called 40 daily grant tests of 100 MCQs, most expected MCQs in NEET PG, right? Yeah. Okay. You take the test, and evening 6 o'clock you have Dr. Murali Bharadwaz to discuss those 100 questions. Khatam. You do it religiously next 40 days, automatically you'll get the seat. Right? Now, the most common presentation of Wilms will be abdominal mass, where the mother, while giving birth, she will realize that her baby is having a mass in the abdomen. Child puke score. It has banana, B for bilirubin, A for albumin, N for neurological status, A for ascites, and hepatic encephalopathy. So this is child pukes. To restore a normal swallowing, how much will you dilate? A minimum should be 16 mm, 1.6 centimeters. If you dilate, then the food can pass through esophagus. What is the commonest type of mesenteric cyst? The chyliolymphatic cyst is most common type. And the most common late postoperative complication of appendicectomy, because of the adhesions, can lead to small bowel obstructions. Good Saul's rule is for the fistula in ano. Anterior fistulas will have a direct track into the anal canal. Posterior fistulas will typically take a curved route. Curved route, that's what you need to remember. Gleason scoring is for the prostatic carcinoma. So you have a small uniform glands, which is basically called the grade 1. More stroma between the glands, grade 2. Distinctly infiltrative margins, grade 3. Irregular masses of neoplastic glands is the grade 4. And only occasional glands, that's called grade 5. Is the Gleason's system. And what is the most common Gleason pattern of prostatic carcinoma, doctor? It is the Gleason pattern 3 is the most common. The most common type of hypospadias is anterior vala, glandular, subcoronal. These are the most common. Then distal penile, mid-shaft, proximal, they are all middle, 30%. Scrotal and pinoscrotal, they are located posteriorly. That's what you need to remember. Undescended testis, what are the most common tumor? Seminoma. Congenital hydrocele, you do herniatomy to treat the congenital hydrocele. A 58-year-old with eczema in the breast. And this is the classical appearance of her nipple. There is no palpable breast mass. So, what is the likely possibility? So basically, she has Paget's disease, which account 1% or less of breast malignancies. There will be nipple erythema, irritation with itching, and it can progress to nipple crushing and ulceration. That is what you need to remember. So, in her case, you need to do a biopsy, which is most important. And if there is Paget's, 97% of these patients will have a underlying ductal carcinoma, is what you need to remember. So how do you treat, doctor? Mastectomy with axillary staging or a wide excision of the nipple and areola. That's what you need to remember. A 6-month-old child presents with a red lesion on the face, which is shown in the figure. So it will be 100% sure, doctor. Port-wine stain, capillary hemangioma, all these birthmarks, you have to be very sure. So fundamentally, a port-wine stain is also called nevus flammeus, is almost a birthmark. And what is port-wine stain? It is a vascular anomaly, a capillary malformation in the skin. And Stooge-Weber, Klippel-Weber syndrome are the scenarios where you find port-wine. That's what you need to remember. Now, hyperacute rejection, why does it happen? Few people will have preformed antibodies. So that is the reason if you are planning any transplantation surgery, don't try to give them left and right transfusions. If you give transfusions, no, you are creating allosensitization. Allosensitization. That's what you need to remember. And that can lead to hyperacute rejection due to preformed antibodies. So, when do you call it a hyperacute rejection, doctor? You're a transplant surgeon, you have done the transplant. The moment you release the vascular cross clamps, the kidney becomes flaccid, mottled, because the deposition of the antibody against the HLE antigens on the endothelium of the glomeruli and microvasculature. And it is the classical complement cascade within the graft which is activated that lead to endothelial necrosis, platelet deposition, and removal of the graft is important. If you don't give adequate immunosuppression, that lead to chronic rejection, which is mainly by anti-graft lymphocytes or antibodies. Acute antibody rejection starts few days, within days after transplantation. There's a rapid graft dysfunction because of the inflammation. It is the recall antibodies or MSC antigens on the endothelium of the donors, peritubular and glomerular capillaries, which are the culprit in leading to acute antibody-mediated rejection, is what you need to remember. A previously healthy 80-year-old woman, early satiety, abdominal fullness, CT scan is being shown here. What is this lesion? Most likely to be, it is a pancreatic cystadenocarcinoma. Now, a 70-year-old, moderate-sized abdominal aneurysm, and he has an aneurysm resected, and he has an abdominal distension post-operatively. So what is this? And how do you treat? So you can see that coffee bean appearance. So it's a cecal volvulus where the cecum is twisted on its mesentery and becomes acutely obstructed. And the cecum is in imminent danger of perforation. So resection of this offending organ with iliotransverse colostomy is considered to be the procedure of choice. After a weekend drinking binge, a 49-year-old alcoholic presents with abdominal pain, nausea, vomiting, and he is febrile. Amylase is 250, CT scan is showing pseudocyst. Now the question comes. So, what is true about pseudocyst? It can lead to gastric outlet obstruction or extrahepatic biliary obstruction, one of the complications. A pseudocyst can develop both in acute and chronic pancreatitis. And the therapy should not be considered for 6 weeks so that you can allow spontaneous resolution. That's what you need to remember. So what are the complications of the pseudocyst? There can be gastric outlet, extrahepatic biliary obstruction, spontaneous rupture. And how do you treat pseudocyst? Drain it. So it can be externally drained or internally drained into the GIT, most commonly into the stomach. Cystogastrostomy is the procedure which is being done. Or Roux-en-Y, limb of the jejunum. That's how you do. Now this woman's condition, you are able to see all the grape vesicles, which is typical feature in case of hydatiform mole. Stenosing pinovaginitis. It has nothing to do with vagina. It has something to do with the finger. It is more common in the women. Adductor pollicis longus, extensor pollicis brevis are affected. It is also called trigger finger. NSAID therapy can be useful. And it is very common in the third or fourth digit. Third, this one, or fourth digit, it is very common, and less common in the thumb is what you need to remember. McMurray's test is for the meniscus injury. It is also called McMurray's circumduction test. If you have done this question wrong, meniscus injury is a beautiful topic discussed in the Incus Learning App video library. Please go back and do a quick revision, doctor. Schumann's disease, Kienbock's disease, all this osteochondritis, you have to be 100% sure, doctor. Vertebral osteochondritis. So what are the complications of the Colles fracture? It is the extensor pollicis longus tendon, not brevis, malunion, Sudex osteodystrophy. Fairbank's triangle, you see it in Coxavara. Whenever infantile Coxavara is there, the epiphyseal plate may be too vertical, and there is a separate triangle of bone in the inferior portion of the metaphysis called as Fairbank's triangle. Yeah. Give me 1 minute, doctor. I'll get some water. So every day, if you are taking the test on the Incus Learning App, the daily test, and if you happen to participate in the evening discussion, all this PowerPoint and also these videos become uploaded into the Incus Learning App. So the moment you play the quiz, the test will go into history. So in the history, you can see the PowerPoint and also the video. Tell all your friends also to join the test. You can also know after every question, how many answered A, how many B, how many C, how many D, everything you can know, right? So that will give you an insight into, oh, this is how people are thinking about the question. Now, in which method of CTEV, all deformities are corrected simultaneously. Ponisetti's method. Except equinus, all deformities are corrected simultaneously in Ponisetti. And usually by a percutaneous Achilles stenotomy is combined. Homovertebral bone, Springle's deformity, where a high hanging shoulder is what you are able to see. A high hanging shoulder. So this shoulder is higher. So it is the homovertebral bone which is present in 35% of cases of Springle's deformity. It runs from the superomedial border of the scapula to the spinous process. So, Springle's deformity. A 50-year-old man with hemiplegia developed a swelling, pain, numbness of the upper limb and lower limb after 3 weeks after the onset of the stroke. There's the classical presentation of complex regional pain syndrome, where you have neurogenic inflammation, nociceptive sensitization, vasomotor dysfunction, and maladaptive neuroplasticity, where the brain starts changing and adapting to the constant pain signals, is what you should remember. Ewing sarcoma, it is the pain which is the most common presenting feature, which is worse in the night. The radiograph of a boy presenting with a limp is being shown. So one of the classical questions. So what is wrong about it? So this is called slipped capital femoral epiphysis. So usually it is seen in obese children because the femoral head capital epiphysis got degenerated. They develop a bilateral Trendelenburg leading to a waddling gait. And the patient holds their hip in flexion and external rotation. So the range of the motion in slipped capital femoral epiphysis, you should remember, it is restricted in internal rotation, abduction and flexion is what you need to remember. And the capital femoral epiphysis slipping is a Salter-Harris type 1 fracture through the proximal part of the femoral epiphysis is what you need to remember. The retinal epithelial layer, pigment epithelial layer comes from neural ectoderm. Now medial rectus, it is inserted on the middle aspect of the sclera at 5.5 millimeters. Corneal endothelium is studied with specular microscopy. Shield ulcers are a feature of the vernal keratoconjunctivitis. They are usually horizontally oval in orientation and involve the upper third of the cornea is what you should remember. Follicles of 0.5 millimeter size. We see it in trachoma. So to diagnose trachoma, more than 5 follicles, each of more than 0.5 millimeters in diameter in the upper tarsal conjunctiva is the part of the diagnosis is what you should remember. Indirect versus direct ophthalmoscopy. You should know all the differences, doctor. So you should know the image is real and laterally inverted is what you need to basically remember. A pseudophakic eye, which rays penetrate up to retina, ultraviolet A. In aphakic eyes, near ultraviolet line, 300 to 400 nanometers can reach the visual receptors. Secondary glaucoma due to uveitis, how do you want to treat? Atropine and steroid. Steroid mainly to decrease the uveitis point. And you need to treat the inflammation and elevated intraocular pressure. So a mydriatic cyclophagic agent like atropine, 1%, fomatropine, 5%, cyclopentolate, 1%. It is mainly administered to break the posterior synechiae and to relieve the discomfort of the ciliary muscle spasm. And for the elevated intraocular pressure, what do you give? Topical beta adrenergic antagonists, alpha 2 agonists, carbonic anhydrase inhibitors. They are considered to be the first line therapy is what you need to remember. And always prostaglandins among the glaucoma drugs, they should be avoided in the eyes where there is a herpetic keratouveitis. And if you happen to use, you are going to exacerbate. Total hyperopia means you have 2 types of hyperopia, latent and manifest squint. Together is called total hyperopia. So manifest means you have not done any cycloplegia. you have not put any cycloplegic, and you calculated the refraction, that is manifest hyperopia. And latent, you can be able to detect only by cycloplegia. Now, this is called bloody thunderstorm appearance of the retina, which is seen in central retinal vein occlusion. It's also called 90-day glaucoma, thunderblood fundus, and in younger children, even a thunderblood appearance can be caused by facial erysipelas. So hypertension, diabetes, vasculitis, OCPs, closed head trauma, alcohol, primary open glaucoma, anything can cause. But of all the causes that you know, doctor, the most common cause which lead to the development of the central retinal vein occlusion would be, the most common cause is diabetes, not the hypertension, is what you need to remember. Now, what is the surface area of tympanic membrane? 90 millimeters square. And about the impedance matching. So, whenever you listen to a huge sound, all that sound doesn't go inside. There are some defenses available to prevent all the sound from reaching inside. So, it reduces the subject sensitivity to his own noise. There's a latent period of 40 to 80 milliseconds from hearing the sound and the reflex to happen. And it is for the sound frequency less than 1000 cycles per second. It is the contraction of the tensor tympani, stapedius muscles, which lead to attenuation of the sound, is what you should remember. At what frequency do you do the pure tone audiometry in case of adult hearing loss? 500, 1000 and 2000. Benign paroxysmal positional vertigo. It is the, nowadays we are completely destroying the vestibular system. Intralabyrinthine streptomycin-like agents are being given in order, which are vestibular toxic in nature. Complete cochlear dysplasia. It is called Bing-Siebenmann's deformity. And complete labyrinthine aplasia is called Michael's deformity. So these are all congenital anomalies basically. So when you do cochlear implant, once more, cochlear implant is one of the favorite topics of the examiner, doctor. Where do you put the electrode array? Most commonly, scalar tympani. So cochlear implant is a hot topic for the PG medical entrance. Now, there's an internal and external electrode. Internal electrode array and receiver are implanted under the skin, above and behind the ear. And intracochlear electrodes are placed in the scalar tympani of the cochlea. Extracochlear electrodes are placed outside the cochlea in the promontory and round window. And intraneurally electrodes are placed directly in the modulus. That is what you need to remember. A patient is having CSF rhinorrhea, a cotton plug is kept near the ear, a dye injected into subarachnoid space, the plug gets stained. What is the cause for the CSF leak? It is a temporal bone fracture. So exploratory canal lacerations or tympanic membrane lacerations, they are typically seen whenever there is a longitudinal fracture of the temporal bone that lead to development of CSF photoria. So basically temporal bone fractures can be the transverse fractures or longitudinal fractures. Longitudinal may you have CSF coming out of the ear, photoria, right? Whereas the transverse fractures, the tympanic membrane is intact and the fluid will build in the middle ear, mastoid, and ultimately drain through the eustachian tube and lead to CSF rhinorrhea. From the nose, CSF comes in transverse fractures. From the ear, CSF comes in case of the longitudinal fractures. That's what you need to remember. So what is the most common site of carcinoma larynx? It is a glottic cancer, most common. 65-year-old, history of change in voice for the last 6 months. Hemoptysis is on and off for the last 4 months. There is a grayish white mass on the anterior 1/3 of the left vocal cord. What's your diagnosis? Squamous cell carcinoma. The primary etiological factor for the contact ulcer is the vocal abuse. Now, doctor, what is the sign of ovulation? Subnuclear vacuolation is a sign of ovulation. So if you go to the Incus learning app, doctor, 3-minute videos discussing 1 or 2 concepts, driving 5 to 10 points in 3 minutes. You have almost 10,000 videos, and every day at least 100 new videos are uploaded, 3-minute videos, all free. Swipe, 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 swipe. If you like the video, bookmark, bookmark, bookmark. You go to the user dashboard. There you can see all your bookmarked videos. So learning is easy. Learning is in community. Learning is by sharing. Learning is free. That is what is Incus app. So please do download Incus app, which is like TikTok for learning, basically. So this is how you see a 16-day endometrium containing subnuclear vacuolation, which is the feature of ovulation, is what you should remember. The secondary oocyte in meiotic 2 division, where do you see? In metaphase. Basically, the secondary oocyte halts meiosis at its second metaphase. Once the secondary oocyte is released in ovulation, if the oocyte is fertilized, then it completes the second meiotic division. If the fertilization doesn't occur, then the oocyte will degenerate without completing the second meiotic division. That's the point. Gravidex test is positive by 2 months. Gravidex is basically agglutination inhibition test performed on the urine sample to detect the pregnancy. Which IUCD has a lifespan of 10 years now? Copper T388. And Levonorgestrel is a levonorgestrel IUD having 60 milligrams of levonorgestrel, which is released 20 micrograms per day, and its life is for 5 years and has a very low pregnancy rate of 0 to 3 per 1,000 per 100 women years. Progesterone SUT is having 38 milligrams of progesterone, 65 micrograms of hormone release per day. Mirena, 52 milligrams levonorgestrel eluting 20 micrograms daily, and it will remain for 5 years. मेरे बात याद रखो मेरे प्यारे देशवासियों. Definitely without a question on IUCD, there's no paper. Emergency contraception. Typically, it inhibits the fertilization, degenerates corpus luteum, prevents the implantation of the fertilized egg. They're all the mechanisms. Until how many weeks of gestation you can still give mifepristone and knock out a fetus? 8 weeks. It is for 9 weeks. That is 63 days of gestation. But it is most effective if used within 49 days of gestation. So mifepristone is also called RU486, doctor. It is a progesterone receptor antagonist is what you need to remember. By when you can listen the fetal cardiac activity? By 6th week of amenorrhea. With transvaginal examination, you can see the embryo when it is 5 millimeters in length. When you see nuchal translucency to detect a Down syndrome, vagera, 11th to 14th week, don't forget. What is the normal weight of placenta? 500 grams, half kilo. Metal serum alpha fetoprotein levels, they can be done up to 15th week. And until about 32 weeks of gestation, it keeps increasing and then it will basically decrease. It is typically measured in the second trimester. Metal serum alpha fetoprotein between 14 to 16 weeks, and elevated metal serum alpha fetoprotein. What does it indicate? It indicates neural tube defects. The start of an active labor. It is a cervical dilation more than 3 centimeters is the shuruat. So the active labor definition is changed from 3 to 4. The start of active labor means from 3 to 4 was the old definition. The present definition is 5 centimeters of cervical dilatation for the multiparous woman and 6 centimeters for a nulliparous woman. That's what you need to remember, the newer definition. In the first stage of labor, how do you monitor the fetal heart rate? At least every half an hour. That is the American Academy recommendation. Now, arrest of descent is failure of the head to descend within 1 hour. So, you should know all these definitions. When do you call prolonged latent phase? Let me once more tell you. 1 MCQ out of 200 MCQs. Guaranteed बोल रहा हूं मैं, guaranteed in tomorrow's NEET PG. अगर ये टेबल से नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं है. You remember nulliparous, multiparous? How do you define each of these? Abnormal labor. Now, the vibroacoustic stimulation is considered normal if a fetal heart rate acceleration is for at least how many beats? 15 beats per minute for at least 15 seconds. And when will it occur? Within how much time? It will occur within 15 seconds after the stimulation is typical definition. And if the heart rate is not accelerating after stimulation, it means to say the pH values, I mean the fetus is in hypoxia, acidosis, vagera vagera. Biophysical profile include fetal heart rate, acceleration, fetal breathing, fetal movements, fetal tone, amniotic fluid volume, all of them are the part of it. Max sulfate, everything, anything about it. Typically, the earliest warning sign is loss of deep tendon reflexes. If the DTR are showing a reflexia, that means magnesium levels are less than 10 milliequivalents per liter. Internal podialytic version in the modern obstetrics, it is only used for the delivery of the second twin, which is in transverse or oblique line. Monoamniotic twins, most commonly intertwinning, is the complication because the tight cord intertwining, that is considered to be one of the important challenges of monoamniotic twinning. So what is the best way that you can assess the maturity of a Graafian follicle? Graafian follicle. In patients with infertility, ultrasound is the best way. You can know. The moment the follicular size reaches about 21 to 23, that is the benchmark to say, okay, ovulation has happened. Paramesonephric ducts, if they don't fuse properly, what do you get, doc? Uterus didelphys. So, two horns is what you need to remember. So, this is how typically you can see the two horns. The two horns where there is a failure of the two paramesonephric ducts, the Mullerian ducts. Gartner duct cyst, it is in the anterolateral part of the vagina. It is a reducible swelling. Rugosity of the vagina is lost, but the mass is well defined. That's what you need to remember. So this is how, doctor, the Gartner's duct cyst. So this is the vagina, this is the bladder, and this is how a well-defined lesion, the Gartner's duct cyst, typically is a, if you separate the two labia, you can be able to see the Gartner's duct cyst is what you need to remember. Now, what is Gartner's duct cyst? It is a remnant of Wolffian duct. Most commonly it is found in cephalad, anterolateral vaginal wall is what you need to basically remember. And a good number of times, incidentally, when pelvic examination is done, you will discover it. And it is usually 1 to 5 centimeters in size. And how do you treat, doctor? Marsupialization, one of the favorite questions of the examiner. Marsupialization is considered to be the preferred method, is what you should remember. The other one is called Bartholin cyst, where the Bartholin duct is being blocked and there is a large cyst in the lower 1/3 of the duct, where this is called Bartholin's abscess. Where do you see? Typically in the inner junction along the anterior 2/3 of the labia. So anterior 2/3 and posterior 1/3. The meeting point is the point where you get the Bartholin cyst and you need to do a lateral excision. Swiss cheese pattern का होता है cystic glandular hyperplasia. This is the favorite question of the examiner, doctor. You have to be 100% sure. I'm so happy to see almost 20 online classmates. Please download the Incus learning app. Below you have the link of that in the Google Play Store. Please become our brand ambassador, post the link and evangelize the concept of Incus learning. Every day, hundreds of 3-minute videos discussing the concepts of NEET PG by thousands of teachers across the country. They're uploaded. Even students, as students, you can create a quick 3-minute video and upload. People will share, like, find you. You can message them. There's a lot of fun in learning. Then, if you go to our courses, you will find one of the quiz courses is 40 grand tests for NEET PG. Subscribe for it today only, and every day morning you will have a new test. Solve that, and evening 6 p.m. I will come to do the live discussion. You take the test, evening discussion. Take the test, take the discussion in the evening. You do it for the next 40 days, doctor. Agar seat nahi aaye to Murali Bharadwaz ka जिम्मेदारी, right? So, doctor, prolapse is another favorite topic of the examiner. A woman less than 20-year-old, unmarried, sling operation. Young woman 20 to 40 of childbearing age, further gym. Women more than 40 years with a completed family and don't want children and don't want menstrual function with prolapse. You should do vaginal hysterectomy with pelvic floor repair. Older women who are not very active in sex intercourse, Leford's operation. So be very sure on the topic of the prolapse, doctor. Transitional cell epithelium. Typically, Brenner's tumor has a background of fibrosis with interspersed transitional epithelium, which is called Walther's nest. Is seen in Brenner's tumor. How much endometrial thickness beyond which you have to worry in a menopausal woman? If it is more than 4 mm, means you have to do the biopsy. So, Ritodrin beta-2 agonists are considered to be the uterine relaxants. After treatment of an ectopic pregnancy with methotrexate, how frequently do you check the HCG? Day 4, day 7. Single agent chemotherapy versus multi-drug chemotherapy. When do you want to give this versus that in hydratiform mode? When there is any rise of HCG titers, if they remain elevated 8 weeks after the evacuation of the hydratiform mode. Typically, HCG will rise and reach a plateau by 2 to 3 successive weeks after you evacuate the molar pregnancy. So if there is no metastasis to liver or brain, you can give single agent chemotherapy. But if there are metastasis, then you need to give combination chemotherapy. Your patient, 43-year-old G3P2 obese woman at 37 weeks gestation. She has a fetus weighing 4 kgs, Her pregnancy was complicated by gestational diabetes. So, what is true? You have to induce not at 38th week. Usually, it is at 40th week if it is a well-controlled diabetic patient. That's what you need to remember. So, any gestational diabetes woman should undergo 75-gram glucose tolerance test 2 to 4 months postpartum. 25 weeks complaining of severe left calf pain and swelling. So, classical lesion of deep vein thrombosis. So, you will do real-time ultrasound to detect the DVT. This is a beautiful question, doctor. Tomorrow's NEET PG जरूर आएगा ये क्वेश्चन. इमेज बेस्ड क्वेश्चंस में आप आंसर बराबर आंसर करना. A woman gravida for para 3, 39 weeks gestation. Membrane was ruptured at 5 centimeters. And the fluid was clear. There has been no indication of fetal distress. Previous infants were 3,800, 750, 4,000 grams. Now the expected weight is 3,200. And typically the partogram has been shown to you. So what do you like to call it as? Initially, there's a good dilatation, doctor. If you look at the cervical dilatation progress, initial part there's a good dilatation, but it has plateaued later. So that is the reason secondary arrest of dilatation. So the woman has entered the active phase. So beyond 5 centimeters of dilatation, this is all the zone of the active phase. And previously she progressed from 2 to 6 centimeters in less than 2 hours. So a multiparous woman normally progresses at a rate of 1.5 centimeter per hour and nullipara 1.2 centimeter per hour. So how is the progression you need to look for? And dilatation at a slower rate, then you call protraction disorder. That is not the case here. This is a case of secondary arrest of dilatation. After initial progress, बाद में NEET PG preparation करना बंद कर दिया. So Dr. Murali Bharadwaz is like oxytocin. You have to give one push in order to stimulate. So now, before you give oxytocin in a case of secondary arrest, where initial progression was good and after that it stopped, you should rule out the cephalopelvic disproportion. But earlier, she has delivered. The baby is of big size. That means there is no CPD. So it is because of hypotonic labor. There is a secondary arrest. In all such cases, you need to give oxytocin. So, doctor, that brings us to the end of this wonderful evening. Today is 5th March. Exam is April 18th. 48 days time is there. बहुत मस्त मस्त मजे में prepare होंगे daily. So what you do? Download the Incus app, right? Tell your classmates, take a video and then put it in your WhatsApp group. I downloaded the Incus learning app and enjoying the 3-minute videos. I'm the brand ambassador. Are you the brand ambassador? And join study with me to study together. Your friends also will download. And there's a lot of fun and competition, sharing and caring on the Incus Learning app. Good night. Once more tomorrow, sharp 6 p.m. with Dr. Murali Bharadwaz. Thank you. So don't forget to take the test and come to the discussion.